طلبة الصف الثالث نكمل محاضراتنا في موضوع الأدوية الفارماكولوجي وخصوصا موضوع non-steroidal anti-inflammatory drugs. We discussed in the previous lectures aspirin and its structure, indications, side effects, contraindications, and poisoning. Also, we discussed paracetamol and its uses, its interactions, and its side effects, and how to manage its side effect. We continue the non-steroidal anti-inflammatory drugs, which is called the non-selective non-steroidal anti-inflammatory drugs, or non-selective salicylate, which is a group belonging to the aspirin. Today we'll discuss a new drugs regarding this group, which is the non-selective Cox inhibitors, which is called diclofenac, and the trade name is Voltaren. Diclofenac, its structures is C14, H11, chloride 2, and NO2. Is a phenyl acetic acid derivatives that is relatively non-selective as Cox inhibitor. Pharmacokinetic and dosage discussed in the previous lectures, in the lectures of aspirin. What about the side effects of diclofenac? Voltaren occurs in approximately 20% of patients, and these side effects include: first, gastrointestinal side effect, which is the common side effect for non-steroidal and aspirin drugs; occult gastrointestinal bleeding; gastric ulcerations. For ulceration may occur less frequently than with some other non-steroidal anti-inflammatory drugs like aspirin. So, how to manage and how to decrease the side effect? First step, a preparation combining diclofenac and misoprostol, which decreases upper gastrointestinal ulceration but may result in diarrhea. As you know, misoprostol is one of the prostaglandin enzymes, which act as a gastrointestinal keeper, protect the endothelium of the stomach. So the first step is the preparation combining diclofenac and misoprostol. Second step is a combination of diclofenac and omeprazole. As you know, omeprazole is one of the proton pump inhibitors. We will discuss later regarding the drugs used for gastrointestinal tract. Was also effective with respect to the prevention of recurrent bleeding. So the first step is combination of diclofenac with misoprostol. Second step to decrease this side effect is the combination of diclofenac with omeprazole. So everybody asks you how to decrease the side effect of Voltaren for the gastrointestinal side effect. Your answer is a preparation of diclofenac and misoprostol. Second is combination of diclofenac with omeprazole. This is the chemical structures of generic Voltaren tablet. Chemical structures, as you know, these two rings. This is the structures of Voltaren. Other side effect, renal side effect, were common in high-risk patients, especially elderly patients. So diclofenac at a dose of 150 mg per day appears to impair renal blood flow and glomerular filtration rate. And this is, as I said, common in high-risk patients. Other side effect, elevation of liver enzyme, serum aminotransferases, may occur more commonly with this drug than other non-steroidal anti-inflammatory drugs. How many preparations we have for diclofenac? We have what is called ophthalmic preparation in a concentration of 0.1%, and this is recommended for prevention of postoperative ophthalmic inflammation and can be used after intraocular lens implantation and strabismus surgery. So this is an ophthalmic preparation. Second preparation, a topical gel containing 3% of diclofenac is effective for solar keratosis. Is one of the cutaneous diseases called solar keratosis. Other preparation is a suppositories, tahamil, it is in Arabic. In rectal suppositories form can be considered a drug of choice for presumptive analgesic or analgesia and post-operative nausea. So it's used for as analgesia and post-operative nausea as a rectal substitute, because the patient with nausea and vomiting cannot take oral preparation of diclofenac. Other preparation available: an oral mouthwash and for intramuscular administration. So we have ophthalmic preparation, topical gel, rectal substitutes, and oral mouthwash. Also we have intramuscular administration. Other drugs belonging to this non-selective salicylate is called diflunisal, and its trade name is Dolopit. Diflunisal is derivative from salicylic acid and is not metabolized to salicylic acid or salicylate, like what happened to the aspirin and other salicylate. It undergoes an enterohepatic cycle with reabsorption of its gluconide metabolite, followed by cleavage of the gluconide to again release the active moiety. This is the difference from other non-steroidal. It undergoes an enterohepatic cycle. And you know the enterohepatic cycles happen 8 times, repeat itself 8 times. Diflunisal is subjected to capacity-limited metabolism. It's claimed to be particularly effective for what? For cancer pain with bone metastasis and for pain control in dental, especially third molar surgery, or in dental surgery, especially the surgery of third molar tooth. So it's effective in cancer pain with bone metastasis or cancer pain due to the bone metastasis, also used for control pain in third molar dental surgery. Because its clearance depends on the renal function as well as hepatic metabolism, diflunisal dosage should be limited in patients with significant renal impairment. Side effect profile is similar to those of other non-steroidal anti-inflammatories, but we add what is called pseudoporphyria has also been reported. So pseudoporphyria is one of the side effects related to the diflunisal dolopid drugs. This is the chemical structure of diflunisal. This is 2 rings, 3O, OH, O, OH, F, F. Other drugs, etolac, and its trade name called etopan. Its structure C17, hydrogen 21, and O3 is a racemic acidic acid derivatives with an intermediate half-life as mentioned in the previous lecture. It is highly or slightly more COX-2 selective than most other non-steroidal anti-inflammatories, with a COX-2 to COX-1 activity ratio of about 10. So it is slightly more COX-2 selective than other non-steroidal anti-inflammatory drugs. Etolac does not undergo chiral inversions in the body like other non-steroidal anti-inflammatory drugs, other racemic non-steroidal anti-inflammatory drugs. Provide good post-operative pain relief after coronary artery bypass operation, although a transient impairment of renal function has been reported. So the main use is a post-operative pain relief after coronary artery bypass. This is the chemical structures of the etolac, composed of 3 rings with 3 O. Other most common non-selective drugs, salicylate, non-selective salicylate drugs, and it is popular drugs, and everybody of us used in his life. It's epiaprophene, which is called in the market Brufen. C13 H18O2 is a simple derivative of phenylpropionic acid. It's one of the group of phenylpropionic acid. Its dose of about 2,400 mg daily can be used. It is equivalent to 4 grams of aspirin in anti-inflammatory effect. So 2,400 mg daily its dose, and ibuprofen or profen is equivalent to 4 grams of aspirin in its anti-inflammatory effect. Pharmacokinetics, as mentioned in the previous lectures. How many preparation for profen? We have oral ibuprofen is often prescribed in lower dose less than 2,400 mg per day, at which it has analgesic but not anti-inflammatory efficacy. So the first preparation is oral profen. Second, a topical creams preparation appear to be absorbed into fascia and muscle and SX formulation has been tested. So we have oral preparation, we have topical preparation, we have a liquid gel preparation. This will provide relief and good overall efficacy in post-surgical dental pain. So liquid gel preparation for post-operative or post-surgical dental pain. We have oral preparation, we have topical creams, we have a liquid gel. In combination with indomethacin or in comparison with endo, what's the difference of profen from indocin? Profen decreases urine output less and also cause less fluid retention than endomethacin. This is the first difference. Profen decrease. So everybody asks you what is the difference between indomethacin and profen? Your answer is that profen decreases urine output less and also causes less fluid retention than indomethacin. Other differences, profen is effective in closing patent ductus arteriosus in preterm infant with much the same efficacy and safety as indomethacin. So profen is effective in closing patent ductus arteriosus with much the same efficacy and safety as indomethacin. So first differences, decrease urine output is less. Second is effective in closing patent ductus arteriosus. And the oral and intravenous routes are equally effective for this indication. This is the chemical structures of profen with one ring, complete rings, and two incomplete rings. This is the chemical structures. As you see, this is the schemes of 3D scheme of chemical structure of ibuprofen. What about side effect of ibuprofen? In fact, we discuss more details about ibuprofen and Voltaren because the ibuprofen and Voltaren are popular drugs and used commonly in our population. The first common side effect, as to other non-steroidal anti-inflammatories, is gastrointestinal side effect. Gastrointestinal side effect and the bleeding, although less frequently than with aspirin. The use of ibuprofen concomitantly with aspirin may decrease the total anti-inflammatory effect. And then the first side is GIT. Second, decrease anti-inflammatory activity when combined with aspirin. Other side effect, rash, pruritus, tinnitus, dizziness, headache, aseptic meningitis, particularly in patients with systemic lupus erythematosus, and fluid retention have been reported. So aseptic meningitis particularly happen or occurs in patients with systemic lupus erythematosus, SLE. Rare hematological effect, agranulocytosis, aplastic anemia. Effect on the kidneys are other non-steroidal, acute renal failure, interstitial nephritis, nephrotic syndrome, but those occurred very rarely. Finally, hepatitis has been reported and elevation of liver enzyme can be. What about contraindication of ibuprofen? The drug is relatively contraindicated in individuals with nasal polyps, angioedema, bronchospastic reactivity to aspirin. So, question, what are the contraindications of aspirin? First, nasal polyps, angioedema, or bronchospastic reactivity to aspirin. Interactions with anticoagulation is uncommon, and they found that the concomitant administration of profen antagonized the irreversible platelet inhibition induced by aspirin. Thus, treatment with ibuprofen in patients with increased cardiovascular risk may limit the cardioprotective effect of aspirin. So, concomitant use of ibuprofen with aspirin decrease the cardioprotective effect of aspirin due to the decreased what antagonize the irreversible platelet inhibition induced by aspirin. Other drugs, non-steroidal anti-inflammatory drugs, it's called the indomethacin or indocin. introduced first in 1963, is an indole derivatives. It is a potent non-selective Cox inhibitors and may also inhibit prostaglandins A and C, reduce neutrophil migration, decrease T cell and B cell proliferation. These are anti-inflammatory activity of indomethacin. Proponency prolongs indomethacin's half-life by inhibiting both renal and biliary clearance. It differs somewhat from other nonsteroidal in its indication and toxicities. This is the chemical structures of the with 3 ring and 2 open rings. Uses is indicated in rheumatic conditions and is particularly popular for gout and ankylosing spondylitis. Mainly used in condition of gout and ankylosing spondylitis. It has been used to treat patent ductus arteriosus, as mentioned, or also Brofen used for this activity. Brofen can be used for treat patent ductus arteriosus, similar to the indomethacin. Other indication: Sweet syndromes, juvenile rheumatoid arthritis, pleurisy, pain in the pleura, nephrotic syndrome, diabetes insipidus, urticarial vasculitis, post-episiotomy pain during labor, and the prophylaxis of heterotropic ossification in erythroplasty. These are like other indication for uses or other uses of indomethacin. Preparation of thyroid preparation, we have efficacious for conjunctival inflammation and to reduce pain after traumatic corneal abrasion. Gingival inflammation, epidural injection, we have also preparation as epidural. Side effect: at higher doses, at least a third of patients have reaction to indomethacin and require discontinuation. Other side effects, like other non-steroidal gastrointestinal side effect, abdominal pain, diarrhea, GIT hemorrhage, and pancreatitis. Headache is experienced by 15 to 25% of patients. Psychosis with hallucination, rarely. Hepatic abnormalities are also rarely. Serious hematological reaction has been noted, including thrombocytopenia and aplastic anemia. Hyperkalemia has been reported and related to inhibition of the synthesis of prostaglandin inhibitors. Renal papillary necrosis has also been observed. A number of interactions with other drugs have been reported. Thank you very much.